Are those for me? Thank you, Matthew. I'm a nerd. Well, good afternoon. Thank you all for taking the time out of your busy schedules to attend this little meeting. How have you all been?
I'm doing great. Excited to be here.
Solid. For the record, I would love us to repeat so we can reestablish who exactly we are representing. I'm Mr. Angiano. I represent both the Schultz, Janet, and Rebecca. So,
I'm Matthew Datloff. I represent the insurance carrier for East Dakota Hospital and the following three doctors, Dr. Rob, Ramon, and Gary.
And I represent Dr. Gordon.
Dr. Wood. Perfect. Well, I'm sure that the both of you have conducted some internal investigations with your own clients in addition to consulting the medical historical records. It doesn't seem to be in dispute that clearly Ms. Schultz was pregnant. Obviously, she went to the hospital on September 16th, right? She was in her 8th month of pregnancy. She went to East Dakota Hospital Clinic. Nobody disagrees with that? Agree. Perfect. So, it seems that, according to her, at least, according to the medical records, she talked to Dr. Ra first. So that was her first interaction with Dr. Ra.
Mm-hmm.
How much time would you say Ra has working?
I think all the doctors I represent specifically don't have a lot of experience. I think we're talking about a year or so. I was saying they're still medical doctors. They've gone through school.
For sure.
And they're qualified to perform medicine.
Absolutely.
So,
Absolutely.
you know, just want to make that clear. We're not talking
100%.
about doctors who weren't qualified to be doing what they were doing.
No, that's not what I'm saying. He is somewhat new, though, correct?
Yeah. Somewhat new, but not unqualified.
So, to my knowledge, Dr. Ra performed some normal procedural things regarding Ms. Janet's pregnancy. Vaginal exam, which revealed a cephalic presentation. Cervix was dilated about 6 centimeters.
Mm-hmm.
The membranes were intact. All this was seemingly normal, correct?
Yeah, I mean, it's my understanding that the patient came in. Well, let's back up. I think it's something to understand before we get to the actual delivery is your client, before coming to our hospital to have that baby delivered, first sought prenatal care 8 months into her pregnancy.
Yeah.
So with that, she was able to establish with us from there. She did deliver the baby there, right? And then when she first saw Dr. Ra, would have been when she was first there. She was about 6 inches dilated, so it was kind of in the beginning of the labor process. I think 6 inches of dilation is when we would consider the labor process to start.
Yeah. I think we're in agreement that at around 8 months, this is what occurred, right?
Mm-hmm.
Yeah.
Well, 8 months is when she first sought care. Obviously, in the 9th month, you know, she delivered.
Yeah. So I also have it that she met a certain Dr. Alfonso Ramon.
Mm-hmm.
Ramon started around the same time as Dr. Ra. They're both pretty new. I'm not saying that they're terrible. They're obviously qualified doctors, but they're both around the same time.
Yeah, specifically Ramon, he commenced his residency July 1st. He was a first-year resident.
First year resident? Okay.
And just to make the record clear, Dr. Ra, she did the initial examination. She's an intern.
Yeah.
But notwithstanding, she's a doctor.
Okay. So I understand that they did everything pretty procedurally correct. Are they supposed to record all of the things they note during those meetings?
I mean, generally speaking, I think obviously best practice is to have a very, very clear record of what went on, what was done, record where the patient is at that given time. That isn't the case here, obviously. There's gaps of information
Sure.
that I don't have access to, so I can't make any representations about that. But what we do know is the patient came in and she saw a plethora of doctors, and
Yeah.
there was complications over the course of this delivery and resulted in a child that has injuries.
Yeah.
Now, where I'm stuck is causality.
Sure.
Okay. But yeah, I mean, to the fact that we don't have all the information, I can only make so many representations about that.
Okay. So, do you feel like it would have been beneficial for Dr. Ra and Dr. Ramon to have possibly recorded certain factors?
I mean, it's always beneficial to have more information, no matter what side of this case you're litigating, right? More information is better. So I mean, kind of equally disadvantaged here, to
Sure.
be honest with you.
Sure.
So I mean, I don't know how we can resolve the gap in info. Like, I can't make it
Yeah.
show up. So, surely beneficial, but.
Definitely, I can understand there being some confusion there.
Mm-hmm.
I know that from what I've been able to get from talking with Ms. Schultz, she would have greatly appreciated the Dr. Ra and Dr. Ramon recording at least those heart rates.
Okay, but I mean, here's the real question. What does your client want? I mean, yeah, we would like, everyone here, I think, would like things to gone more smoothly,
Oh, for sure. Yeah.
obviously, and it didn't, we know, no one here obviously wanted the result that we had, but what does your client want?
Well, me personally, I can manifest to you two that based on what the injuries the Schultz have suffered, they're seeking $2.5 million in damages. This restitution will make them whole, and obviously this amount will satisfy all their injuries that they have acquired and they will possibly continue to acquire. And I understand that you two might have some reservations about that number, but I do think that if we get more into what occurred at the hospital, it might be a bit more easy to comprehend that number.
But before going into what occurred at the hospital and start pointing the fingers,
Mhm.
how do you get to that number?
Certainly.
I don't have a calculation of damages. I don't know how you got to that number.
Certainly. I'm guessing you would like one as well?
Sure.
All right. So, based on the injuries that Ms. Schultz, the mother, Rebecca, she received multiple injuries regarding since attending the hospital for her birth. There were errors done by the doctors, everyone involved. Ms. Behary noted that Dr. Gibson had made some errors. There were errors done by Ramon and Rod.
Okay.
In addition, the baby suffered multiple injuries. She was essentially, I wrote them down since they're complex medical terms in order to simplify them a bit.
Okay.
But as a result of these injuries, the daughter, Rebecca, suffers severe injuries. That's not in dispute.
Do we know what her life expectancy is?
Yeah, we do. A lot of people are saying she won't make it for past 10 years.
Okay, so $2.5 million is a number saying, hey, I'm going to live with these injuries for the rest of my life.
Yeah.
If the expectation is 10 years, I think $2.5 million is a lot of money for 10 years.
I would be inclined to say that $2.5 million is a lot of money in general. Wouldn't you agree?
I actually have a different concern rather than the damages.
Sure.
I don't want to go into my defense, but what is the case for professional negligence in this case?
Yeah, so the doctors involved in the childbirth procedure did not adequately comply with the standard of care as prescribed in the hospital regulations, nor did they adequately check sufficiently. They did not make detailed note of what was occurring during the
So
pregnancy.
you're saying they follow protocols.
Come again?
So you're saying, in essence, my clients, Dr. Gibson, didn't follow protocol. Is that the boiling it down?
I would say that the lack of following protocols definitely contributes to the total sum of damages incurred.
Okay.
But in addition, there was just essentially the doctor should have done things that were not done, and if they did do things, it was done
So
incorrectly.
what are those things?
So one of the things that they did incorrectly was the administration of Pitocin. Are you familiar with Pitocin?
I am. My understanding of it is that it is supposed to induce contractions,